5 common symptoms of female ovulation and how to deal with them. I'm no longer panicking after reading this. We all know that the female menstrual cycle is a very complex process, consisting of 4 stages: the follicular phase, ovulation phase, luteal phase, and menstrual phase. And among them, ovulation can be an absolute joy for some and a real worry for others. For sisters who want to conceive, ovulation is a crucial window period. In contrast, for some sisters, ovulation can cause various discomforts, such as vaginal bleeding, abdominal pain, inflammation, and increased libido. So today, we have collected some troubles of ovulation and invited a gynecologist to answer them for everyone. We will discuss these topics. Does ovulation cause an increase in body temperature? What to do with ovulation bleeding? Is treatment necessary when moderate cervical inflammation is found during ovulation examination? What causes abdominal pain during ovulation? Why do I have increased libido during ovulation? Does ovulation cause an increase in body temperature? Body temperature does not rise before and during ovulation, only after ovulation does the body temperature rise. After ovulation, the ovary secretes the hormone progesterone, which acts on the temperature-regulating center, causing the basal body temperature to rise by 0.30.5 C. It is important to note that ovulation must occur before the body temperature rises, so using basal body temperature to guide the timing of conception is not appropriate. When the body temperature increases, the follicle has already been released, and it is too late to have intercourse. In addition, the method of measuring basal body temperature has specific requirements, and it is not like measuring temperature with a thermometer under the armpit in our daily life. The requirements for measuring basal body temperature are to shake the mercury column of the thermometer to below 36 C before sleeping, rest for 6-8 hours, and measure the temperature after waking up without talking, eating, or other activities. The temperature measured under the condition of sufficient rest can reflect the primary state of the body. Later, the body's movement will cause the temperature to rise, making the measurement results inaccurate. The method of measurement is to hold the glass thermometer under the tongue. Measuring under the armpit is easily affected by the ambient temperature, so it is recommended to measure under the tongue. The significance of measuring basal body temperature is to understand if the ovary is ovulating. If the temperature does not rise, it indicates that there is no ovulation. If the degree of rise and duration do not meet the requirements, it suggests that the corpus luteum may be malfunctioning. If the temperature remains at a high level without a decrease and there is no menstrual period, then it may be a sign of pregnancy. Generally speaking, even if basal body temperature rises, it should not exceed 37.0 C. If, as in the text, a woman's temperature reaches 37.5 C, it should be considered as low-grade fever and should be seen by a doctor for diagnosis and treatment. What to do with ovulation bleeding? The possible causes of intermenstrual bleeding are organic diseases, meaning that the body is actually sick, such as cervical lesions, endometrial polyps, uterine fibroids, adenomyosis, etc. Organic diseases often require a physical examination or auxiliary examination to confirm. For example, TCT and HPV can screen for cervical disorders, and ultrasound can screen for endometrial polyps, uterine fibroids, and adenomyosis. There is also a non-organic disease caused by bleeding, commonly known as ovulatory bleeding. Ovulatory bleeding is not caused by illness but by regular physiological changes in the body. As the ovary grows, the estrogen level will increase, reaching a peak before ovulation, and after ovulation, the estrogen in the body will temporarily decrease. When the decrease in estrogen exceeds half of the original level, the endometrium will bleed due to the loss of estrogen support. Generally, after 2 to 3 days, with the enhancement of the function of the corpus luteum, the level of estrogen in the body will increase again, and the bleeding symptoms will disappear. A small amount of bleeding in a short duration causes ovulation bleeding. If the bleeding does not affect your daily life, it can be left untreated. If there is discomfort, there are 2 ways to deal with it. One way is to supplement with a small dose of estrogen before and after ovulation to prevent bleeding by reducing the amplitude of hormone fluctuations. Another way is to take oral contraceptives, which suppress ovulation and hormone fluctuations, and thus prevent bleeding. However, ovulation bleeding is caused by hormonal physiological fluctuations, and generally stops after 2 to 3 days. If it lasts longer than 2 to 3 days, it may not be ovulation bleeding, and you should see a doctor to find out the cause. Structural diseases such as endometrial hyperplasia or uterine fibroids can cause abnormal bleeding, and non-structural conditions such as an ovulation or luteal dysfunction can also cause bleeding. Of course, occasional abnormal bleeding may be related to recent emotions, stress, or changes in habits. If abnormal bleeding occurs frequently, it should be taken seriously. You can consider endometrial biopsy surgery if you suspect an abnormal endometrium, such as endometrial hyperplasia or endometrial cancer. Segmental diagnostic surgery is a commonly used surgical method, but it is prone to misdiagnosis due to blind scraping. It has been gradually replaced by hysteroscopy-assisted biopsy, which can reduce damage to the endometrium. For the frequently asked question in the text, if it is only one abnormal bleeding, it is unnecessary to scrape the uterus immediately. If abnormal bleeding occurs repeatedly, it is necessary to seek medical attention in time. If it is necessary to investigate endometrial problems, it is recommended to use a hysteroscopy examination. The thickness of the endometrium does not need to be a particular concern because a thicker or thinner endometrium does not mean that there is a disease. Is treatment necessary when moderate cervical inflammation is found during ovulation examination? The characteristics and secretion of female vagina secretions are not constant and are affected by hormones within the body. As normal ovarian follicles develop and grow, estrogen levels also increase and reach a peak when the bristles are at their largest. Under the influence of estrogen, the secretion of cervical mucus increases, becoming thin, transparent, elastic, and egg white-like, and may show a stringy appearance. This type of cervical mucus usually lasts for 3 to 4 days. As ovulation occurs, progesterone levels gradually increase, reaching a peak around the week before menstruation. Due to the involvement of progesterone, cervical mucus becomes thick, cloudy, less stretchy, and white and opaque. This cervical mucus usually lasts for 1 to 2 weeks until menstruation. Therefore, the increase in secretions during ovulation in females is standard. Treatment is unnecessary if the characteristics are typical and there is no odor itching. What causes abdominal pain during ovulation? The leading causes of ovulation pain are 2. One is that during ovulation, the ovary releases a small amount of fluid or blood, stimulating the nearby peritoneum and causing pain. However, in most cases, the amount of fluid released is minimal, and most women will not have significant pain, but a small number of more sensitive women may have ovulation pain. 2 is that the mature ovary secretes prostaglandin, which causes smooth muscle contraction to promote ovulation and causes the fallopian tube and uterus to contract, resulting in abdominal pain. The pain usually lasts for a few hours to 2 or 3 days and is generally not severe enough to require treatment. However, there is one situation that needs attention. Ovulation pain is not necessarily ovulation pain, and other diseases need to be ruled out, such as pelvic inflammation, ovarian cyst rupture, and so on. In short, ovulation pain is a normal physiological response, so if you encounter this problem, the first thing to do is to adjust your mood, relax, and avoid tension and anxiety. For severe symptoms, pain relief treatment can be considered. For women who need contraception, taking oral contraceptives is one of the options to avoid the physiological response of ovulation. Why do I have increased libido during ovulation? Both the nervous and hormone systems regulate human sexual response. When the body receives external stimuli such as touch, sight, smell, and sound, the brain regulates sexual response through the nervous system. In addition, hormones play an essential role in regulating female sexual response, with the main sex hormones being testosterone and estrogen. Estrogen peaks during ovulation, so sexual desire increases before and after ovulation. In certain conditions, pregnancy hormones may have a suppressive effect on sexual response, meaning that after ovulation, as pregnancy hormones increase, sexual desire may decrease. This pattern is in line with the physiological requirements of reproducing offspring, and individuals should not blame themselves or feel overly burdened by their thoughts. We are all influenced by hormones. If concerned, one can go to the hospital to check hormone levels and rule out pathological abnormalities.